you, world, what we can do? We never stop learning.
You want to start us off?
Yes, I first want to welcome Leesa G. Leesa G, licensed acupuncture.
Thank you.
Oh my goodness, she's been a friend of mine for I don't know how many years,
Yep.
quite a few years.
Yep.
And how did we meet, Leesa?
You came over and removed some wallpaper for me.
That's right. That's right.
And we just hit it off.
Yes, and you had some vintage wallpaper that you said you would like me to put on your little
Oh,
bathroom.
that's right.
Yes,
Yeah.
it's still there?
Yes, it is.
Okay.
It was in my powder room. It's like silver with pink poodles.
Oh, that's right.
It's this old. It was this really old roll of 50s
Vintage
wallpaper.
wallpaper, right.
And you were able to make sure, even though it was so old and everything, you were able to put it up without any problems or it crackling.
Oh,
or,
no,
no,
that's
it's
right.
beautiful.
Oh, good.
Yeah.
Well,
Thank you.
before I start talking, I want to show everybody my hat. This I got at the 99-cent store, and it says "Wild and Free,"
And that's you.
and that's me, Leesa.
That is you.
Anyway, so what would you like to talk about first? How did you become an acupuncturist?
Okay, well, like we were talking about a little bit before,
Yes.
I would say, oh God, this was maybe like 10, 15 years ago.
Okay.
I went to the doctor for a normal physical, and I just happened to mention that I was a very bad sleeper. I had a lot of insomnia, and most of my life I had not been a good sleeper. And so he prescribed a sleeping pill whose name we will not mention lest we be sued.
Okay. Right.
And he had me just take that pill every night. Well, at some point, I would say after taking it for about 3 years, I built up a tolerance to the pill. And then it didn't work anymore.
Right.
And so I started experiencing withdrawal symptoms. And he wanted me to take even more and more of the medication to stop the withdrawal.
Oh.
And it really bad withdrawal symptoms like nausea, sweating. I couldn't sleep for days. My hair was falling out.
Wow.
I was losing all this weight. And I just thought, well, if I'm having these kind of symptoms withdrawing from this pill, I don't want to take it anymore.
Right.
So I did a really dumb thing. I just stopped it
cold turkey. Yeah.
And that put me into something that is called extended withdrawal syndrome. And not much was known about this pill at the time, so nobody could really help me with it.
Okay.
So I went through 3 years of withdrawal symptoms.
Wow.
Where I would go for days without sleeping and I couldn't keep food down. I looked like a scarecrow. So I tried, I went to all these different doctors, Western doctors, addiction specialists, psychiatrists, because then they decided it was all in my head. And they kept trying me on all these different psych meds, and I kept getting sicker and sicker. And so finally, I never thought I was going to get better. And it really came down to, I've got to try something completely different as sort of a last effort, last resort. And I really didn't know anything about acupuncture.
Right.
But I was like, hypnosis didn't help me, Western medicine didn't help me. I was just getting sicker and sicker, and I was like, I'm going to literally end up committing suicide because I can't stand this. And it's been years now, and it had gotten to the point where I couldn't even leave the house. So I could barely even dress myself. So out of desperation, I thought I'll try something really different that I've never tried before, like acupuncture. And if that doesn't work, okay, that's it. I'm done. I give up. So very luckily, I did some research on Google, and I lucked into finding Dr. Michael Fox of Silver Lake Acupuncture, and went to him for treatment. And I saw him once a week for about 6 months. And at the end of 6 months, I was completely myself again.
Wow.
Completely normal.
That's a miracle.
And I was actually, that was my 50th birthday. So for my 50th birthday, I did a reunion show with my band. And
That's right, you were a singer, right?
Yeah.
Oh my gosh.
so I went from being a woman who could not sit still in a movie theater, who couldn't keep food down, who couldn't sleep, who couldn't leave the house, who had anxiety so bad like my skin would crawl, to being completely normal and being on stage in front of an audience within 6 months from the treatments with Dr. Fox. And so I just decided I wanted to do that for other people because of the experience I had been through.
Sure.
I didn't want other people to suffer the way I had suffered.
Right.
So I was 51. Yeah, it was my 51st birthday. And I went back to university and I enrolled in the acupuncture program at Dongguk University in Koreatown. It's a 4-year master's degree. It took me 6 years because I was working and everything at the same time. And, you know, some people think acupuncture is like a very quick degree or an online degree.
No.
It's a 4-year master's in medicine.
Right.
And you also, in California, we have the strictest requirements. So you also are required to do at least 960 hours as an acupuncture intern in the clinic. And then we have to pass a 5-hour licensing exam, which is arguably the most difficult licensing exam in the United States. Because not only in California, not only do you have to be an acupuncturist, you also have to be an herbalist. Okay. In other states, you have a choice. You can be one, the other, or both. Oh. But in acupuncture, we have to be both.
In California.
Yeah. Oh, excuse me. In California, we have to be both.
Right.
And we also learn just about an equal amount of Western medicine because they want us to be able to speak to Western doctors in terms that we can both understand.
Good.
So we learn orthopedic exams, we learn how to read lab results, we learn about Western pharmaceuticals and all those things as well.
Great.
So I know it's a long answer.
No, but and what impressed me when I first started, when I steamed wallpaper off for you, I was so impressed because, see, that's what I want to talk about to the other people in the world. Mm-hmm. We're never too old to start learning something new.
Right.
And I'm so proud of you.
Oh, thank
You're an
you.
inspiration. And I want everybody in the world, no matter what age, you can learn something new.
Absolutely.
Right?
Well, look at you. You're doing wallpaper at
83 and a half.
83, yeah. So
I'll be 84 in April. April Fool's Day of all things.
Of
you know,
course.
but
Well, that fits you.
that fits me. I know you gave me a treatment once when my knees were hurting. Mm-hmm. And my gosh, I haven't had to have a treatment since. You're going to give me another one someday because just because I think it would
give you a little tune-up.
Yeah, tune-up. So how does acupuncture work?
Okay, well, that's a really complex question.
Okay.
And a lot of times when people ask it, I find they want me to convince them that it works. And the first thing I want to say is I'm not here to convince anybody it works.
Okay.
You know, if you want to try it and see if it works for you, great.
Right.
But I'm not here to browbeat anybody and try and convince them. You know, a lot of people really want to argue about it and get into it, and I'm not into that. Okay. So I'll try to put it in as simple as terms as I possibly can.
Okay.
In Chinese medicine, we believe that you have a lot of meridians running all through the body. I'm sure you've probably seen like that acupuncture statue with all the lines all over it.
Yeah.
You know, I think a lot of people have seen that.
Yes.
Okay, I was going to bring mine with me today, but I got lazy and I didn't bring it.
Okay.
But those meridians, they can be called channels, meridians, pathways, superhighways. All those terms are interchangeable. Oh. So in Chinese medicine, we believe those superhighways, if you will, are running all through your body. Mm. And you have an energy on those highways called qi. It's spelled Qi. So a lot of people pronounce it qi, which drives me crazy. Uh-huh. It's qi. Qi. So the qi is this energy that flows all through your body. And in Chinese medicine, we believe that when you have homeostasis and you have balance and all the systems in your body are working in harmony, that qi flows evenly and properly through the body. Wow. But just like a freeway, with cars on the freeway, you can have a pileup. Where the qi is stagnated. You can have rain where there's too much dampness with the qi. You can have high winds where there's wind affecting the qi. So we believe in Chinese medicine that you have everything in your body that you personally need to be the healthiest version of you possible. And all we do is rebalance things when they get out of balance and rebalance that energy and keep that energy flowing smoothly so that your body heals itself. And that's one of the major differences between acupuncture or traditional Chinese medicine and Western medicine. Because in Western medicine, the doctor is basically a god. The doctor is like, I heal you.
Oh.
But in traditional Chinese medicine, we believe you heal yourself.
Ah, that I like.
We just get everything on the right path
Yeah.
so that you can heal yourself.
Ah.
Some more differences between acupuncture or traditional Chinese medicine and Western medicine. Traditional Chinese medicine and acupuncture has basically no side effects. You know, you might get a little bruise here or there, you know, from the needle. Uh-huh. But basically, as long as it's being done right, you don't have side effects.
Well, I didn't feel any pain at all. And before you ever gave me a treatment, I was a little apprehensive because everybody goes, oh, I don't want a needle, right?
Yeah.
I had no, because your needles are so thin.
Mm-hmm.
You know.
Well, they're generally the thickness of a human hair.
I know it.
They're bendy,
Yeah.
like a guitar string.
Uh-huh.
And when you go to the doctor and you get a vaccination or a shot,
You feel it.
that needle's hollow. So it's a big needle because you have to get medicine through
Right,
it.
so people think that's what they're getting. Uh-huh.
It's just like the thickness of a human hair.
I know it.
And my youngest patient is 8.
Oh.
And you're my oldest patient.
Yay!
Actually, you know what? You are not my oldest patient anymore. I do
Oh.
have an 84-year-old patient, so they beat you by a little bit.
That's good. Well, I wanted to be the oldest, but that's okay. I'm next to the oldest.
There you go.
Okay.
But, you know, most acupuncturists do not hurt you with the needle.
No.
I'm known for being exceptionally gentle, and that's why I have very young patients and older patients.
Great.
And that's why my practice is called Queen Bee Acupuncture, because it's Queen Bee, no sting acupuncture.
Oh, isn't that clever?
But that's the number one thing we hear all the time. I'm afraid of needles.
Oh, I was talking to a girlfriend last night. She said, oh, I hurt my knee. She said, oh, but I'm afraid of needles. I said, but this lady, you don't feel them. Mm-mm. And I said, I'll ask her all about it for you. So
I very rarely have anybody experience any discomfort.
No.
One thing you might feel is when the needle hits the chi, taps into that energy, sometimes you'll feel a pulsing or a feeling like maybe somebody's pushing on a bruise. We call that the arrival of the chi.
Oh.
The language in Chinese medicine is very operatic.
Oh, good.
So,
I like that.
Yeah, I do
it's
too.
dramatic.
I know.
I'm dramatic.
The uterus is called the palace of the fetus.
Oh, cute.
Yeah, it's very operatic. So if you do feel that little feeling like a pulsing or the feeling of a bruise, that's actually a good thing because it means we're really tapping into that chi.
Okay.
But generally, other than that, people don't really feel anything, and most of my patients pretty much fall asleep on the table.
Oh, that's great.
So
that's great.
But I just wanted to get back to one thing about the original question about how TCM, traditional Chinese medicine, how it works.
Okay.
Another major difference between Western medicine and TCM is that the way we treat you is unique to you, and it's unique to each person.
Great.
So you could send me 2 people with high blood pressure or diabetes, and each of those people, I would probably treat them differently because I'm going to, in Chinese medicine, how do I explain it? In Western medicine, it's like, oh, you have diabetes, here's some metformin.
Right.
To bring your blood sugar down.
Right.
But in Chinese medicine, it's like, which of the channels in your body is out of balance that's creating that diabetes? And how can I rebalance it so that you don't need, and not that I would ever tell anybody not to take their prescription medicine.
No.
But, I'm going to rebalance what's off with you rather than this person over here.
Because we're all individuals.
Exactly. And the treatment's going to be unique to you every time.
That's right up my alley. Because I believe in every individual, and I want people to believe in themselves. Mm-hmm. I want them to love themselves, and then they can love others and be kind. But if you don't feel good about yourself and aren't in tune and in balance, it's not as easy to live.
No, of course not. It's very difficult to live when you aren't in balance.
I also wanted to ask you, I watch Animal Planet. I love to see the animals because I learn from the animals. We all can. And they had this elephant, it had some arthritis. And so the vet said, oh, one lady said, I think we should try acupuncture. Oh, the vet said, no, well, let's try it. And you know what? It's helping this elephant. The elephant is back to normal.
Well, I have two things to say about that.
Okay.
Okay, one is we all know insurance companies don't like to pay for anything, right?
Yeah.
But the two things that most insurance companies will pay for acupuncture is pain and nausea.
Oh.
So what does that tell you about acupuncture treatment for pain? You know, if the insurance company is willing to pay for it, there must be something to back it up.
That's
right?
true, yes.
The other thing is I love it when people do animal acupuncture and have good results, because one thing that people say when they want to poo-poo acupuncture is, oh, it's a placebo. And you can't give an animal a placebo.
No.
Right? If you have a cat and the cat's back legs are paralyzed and you give it acupuncture and it's got movement in the back legs, you didn't give the cat a placebo. The cat can't understand that, right?
That's right.
And so I have seen acupuncture work for cats, dogs, horses, turtles.
Wow.
But in California, to do acupuncture on an animal, now I may be incorrect on this, but I believe I'm right. You not only have to be a licensed acupuncturist, but you also have to be a licensed vet tech.
Okay.
I'm pretty sure.
Well, I'm sure that on the planet, the Animal Planet show that I watch, they must be.
Well, I'm
licensed.
just saying in case anybody's interested
Yeah.
in that. I can't do acupuncture on an animal.
I see. Okay.
I'm a licensed acupuncturist, but I'm not a vet tech.
Right, I got it. Okay, good.
So you were asking about what are other modalities
Okay,
besides acupuncture
yes.
in traditional Chinese medicine.
Okay,
So besides acupuncture, we, like I said, we are licensed herbalists.
oh,
So we have many, hundreds of thousands of herbs and formulas that to help treat people besides the acupuncture. We also have something called cupping. Have you heard of cupping? Okay. So I think it was just made brought more to the public's awareness in the last Olympics, because a lot of the athletes had the cupping marks on them. It looks like a giant squid attacked you. They're like big suction marks all over you.
okay,
And basically what it is using a cup. Some people use a plastic cup with a pump. I prefer the ancient method of using a glass cup with fire, with a lit punk. And what I do is I put some oil on your back, and then I take a glass cup, and we'll do a demonstration of this, and it'll be in the video. But
okay,
I swoosh the lit punk around in it, and then I quickly put it on your skin, and that creates a vacuum that sucks up your skin.
okay,
And with the plastic cups, they put a plastic cup, and they have a little pump, and they pump it, and it does the same thing.
okay,
Excuse me. So what that does is it brings all kinds of blood and collagen, fresh, clean blood, and elastin to the area. So it's very good for alleviating pain. We use it a lot for back pain. It's also good for a facial, to bring all kinds of elastin and collagen and circulation to the face. And
You
also
have small enough cups?
Yes,
for
I
the
do.
face?
I do.
Okay.
And to drain gives you some lymphatic drainage. And it's also really good if you have a cold or you have a lot of phlegm in the lungs, because your lungs are very close to your back.
Right.
So you put the cups on and you pump it, and it helps draw phlegm out of the lungs. So it helps with a cold.
How interesting.
So that's another modality. Herbs and formulas is another modality. I just went to a seminar this weekend with the American Acupuncture. Oh, shoot. I wanted to give them a plug. The American Acupuncture and Alternative Medicine Association.
Oh,
And they had a speaker come in who treats mental illness with herbs only. And he has a 50 to 70% success rate with Chinese herbs and Korean herbs, treating everything from paranoid schizophrenia to mild depression.
right.
So we can really do a lot with herbs. And we can use herbs to treat diabetes, depression, anxiety, high blood pressure, Crohn's disease, to help people lose weight, to help with PMS, menopause. We can use both herbs and acupuncture to treat anything like that. Anything that's kind of chronic responds very well to Chinese medicine usually.
Wow, it's a miracle to me.
It's a miracle to me too. I have a patient who was diagnosed with diabetes, and she didn't live in this. She lives in Kentucky, and her doctor gave her metformin, and I did an herbal prescription for her, and she went back to her MD a month later, and he was like, "We can take you off the metformin."
That's a miracle. There you go.
Now again, don't anybody stop taking their prescription.
Okay, right.
You know, I would never
Right.
tell anybody to do that.
No, of
You
course.
have to check with your MD.
Sure.
But definitely we can work hand in hand with your MD.
That's what I like. Working
To-
together.
Yeah, to try and reduce the amount of meds that you take. Plus, my practice is nutrition based. So in Chinese medicine, herbs and nutrition really go hand in hand.
But
'Cause
they do anyway in life.
Yeah.
I mean, when I was 30 years old, I read this book called Back to Eden. And everybody said, oh, she's a quack, that Rita, she's, because she believes in all that stuff. But, I'm the healthiest person. I'm very healthy.
Yes, you are.
And how could I hang wallpaper up and down a ladder at
Yes,
my age?
I know.
I can work 8. Now, sometimes when I get up from sitting all day, I'm a little stiff when I first get up. But I can work on a ladder all day long and not be stiff. So, but it's you. I
You're
say
extremely healthy.
you are what you eat. You are what you think, and
That's completely true.
yeah.
I really hope. I'll just say I'm for socialized medicine, and I'm sorry if anybody doesn't like that, but I feel like I want all God's children to be covered with insurance and be able to get the medical treatment that they need. Excuse me. Regardless of income, and I don't want anybody to go bankrupt or or die because they can't afford their medicine. And that's why I'm for socialized medicine or whatever you want to call it, expanded Medicare or universal health care, whatever you want to call it.
Yes.
I want all God's children to, be taken care of medically.
That sounds good to me.
Yeah.
I mean, that's way everybody should feel that way.
Well,
I mean,
I think so.
yeah, it's so simple.
I have a friend who cuts their diabetes medicine in 4 because they can't afford it. I have another friend who died from a seizure because he ran out of his diabetes medicine.
See?
Couldn't afford it. I have friends I have a friend that was in a very catastrophic car accident and lost everything, his house, his life savings, because I have another friend who passed away because she was getting cancer treatment for throat cancer, and there was a $750,000 cap on her insurance. And once her insurance paid that out, they said, sorry, you're on your own. So that's the first thing. I would really like to see universal health care. And of course, with universal health care, I would like to see traditional Chinese medicine included in the coverage. You have to remember with traditional Chinese medicine, there's really no downside. It's not addictive. There's no side effects.
Right.
It's natural.
I know. It's
It,
perfect.
but
it just takes education. We have to educate the world.
Yeah.
And that's what we're doing here on the Rita Show.
well, we're trying.
Oh, well, we're trying. That's right. Yeah.
In China, some people have acupuncture or TCM every day. In China, they kind of think we're crazy that we wait till we get sick and then we go to the doctor.
Uh-huh.
It really is all about preventative medicine.
Oh.
If you are living a balanced life with how much sleep you're getting, what you're eating, and it's all about balance
And exercise.
and exercise.
Everything is important.
It's
Right.
all about balance and homeostasis.
Oh.
So, actually, I would, in my opinion, the traditional viewpoint with traditional Chinese medicine is to stay healthy rather than treating someone after they get sick.
Absolutely.
Now, normally, I would take your pulses, look at your tongue, and diagnose you, and would try to figure out where the imbalance is in the body and treat that imbalance. But for the purposes of our demonstration today, I'm just going to put some points in and around Rita's knee because she has a sore knee. So I always wash my hands really well, or if I'm in the field, use some hand sanitizer. And this is a little bit of alcohol. And put that around the area that we're going to treat.
Okay.
Okay. And we're going to use the blue needles here because they're a little smaller. And I don't know, Glenn, would you like to get a close-up on a needle?
You go towards Rita's knee.
Okay.
There you go.
So
And I'm zooming in, zooming in, zooming in.
you can see how it's really bendy like a guitar string.
Yeah.
And it's, you know, extremely, extremely thin. All right, since I've contaminated this needle, I'm going to put it in my little red biohazard bin. Okay. All right, so now I'm going to start with a point called Heigu. That's right here on the top of the knee. Bink. That's it. The first needle's in. You okay?
I don't feel a thing. There's something weird here. No, I'm just kidding. It's not weird at all. I love it.
Okay. Now I'm kind of at a bit of a weird angle, but I'm gonna, don't move your leg, please.
Okay,
I'm
okay.
gonna try and find stomach 36 on you.
Okay.
I like to run my finger up the shin, and it goes right into this divot right here.
Right.
This point is called stomach 36. It's arguably the strongest point in the body. We call it the immunity point.
Wow.
It really boosts your immune system.
Oh boy.
Okay, and then I'm going to do right here a gallbladder point, because the gallbladder channel and the liver channel, they're paired together like an old married couple, and the liver is in charge of your tendons. The liver channel is. So the gallbladder and the liver can work together to relax tendons and muscles.
Oh.
Now when you get the knee pain, around what part of your knee does it usually hurt? Don't move too
Don't
much.
move.
Yeah.
I guess inside. I just.
Like in
Yeah.
like around here.
Yeah.
All right, so I'm going to do a few needles for what are called ashi points.
Okay.
These are not traditional acupuncture points. They are just, an ashi point is a point in the area, basically it's a point in the area that hurts.
I see.
And we're just trying to send some of that chi energy
Chi energy.
to the area. And also, I forgot to mention before, which I will mention now, those channels or meridians or superhighways, whatever you want to call them, they're all named after an organ in the body, like the heart channel, the liver channel, the spleen channel. And it's kind of a rough angle here, but I'll give it a shot. It doesn't mean, like if I say you have liver chi stagnation, it doesn't mean there's anything wrong with your liver,
Okay.
with that organ. It just means that the chi on the liver channel, on the superhighway that's named after the liver, that chi is stagnated and backed up like a traffic jam on the freeway.
Oh.
Okay, so you're fine?
Yes.
No problem?
No problem.
All right, so we leave this in for about 20 minutes.
Okay.
But while we leave this in, I guess we're going to cut and come back, and I'm going to give you a little cupping facial.
Ooh, wow.
Okay?
Yes.
Okay, good.
Thank you,
My
Lisa
pleasure.
G.
Don't move your leg.
No, I won't move a thing.
Generally, acupuncture needles are retained for about 20 minutes.
Okay.
So we're letting your knee retain the needles.
All
I'm
right.
going to put this towel around your hair.
Okay.
And we're just going to lean your head forward.
Mm-hmm.
We're just going to do like a little cupping
Oh,
facial.
Good.
Now,
Yeah.
facials I generally do with acupuncture, but they can also be done with cupping.
Okay.
One very interesting story I think about the facials is when I was in school, one of the guidance counselors came up to me and said, you should do cosmetic acupuncture. And I was a little bit offended. I was like, no. I'm in this to heal people. I'm not in this to make people beautiful.
Oh.
But what I found is the universe basically sends me, I would say 50 to 75% of my patients come see me for mental health issues.
Uh-huh.
And some of them asked about adding the acupuncture facial. And I was like, well, okay, I'll add it. We'll do that.
Mm-hmm.
What I found was that it helped them get better mentally and emotionally because they looked better
Oh.
and so they felt better. So
Perfect.
now quite a few of my patients do get the acupuncture facial. So we're not doing the full-on facial today. We're just doing like a little bit because we're not really set up here to do the whole thing.
Sure.
So the first thing I'm going to do is just put a little almond oil
Okay.
on your skin,
Sure.
which is, very good for your skin.
Yes, you gave me some of that years ago.
It's very moisturizing.
For my birthday, you gave me almond oil.
Yep.
Yes.
And it's going to smudge your makeup a little
I don't have
bit.
makeup on.
Okay.
Only eye makeup a little
Well, it's
light
going to smudge it a
eyeliner.
little bit.
No,
Okay.
everything is good.
A little on the throat. And I think for the facials, I'm going to start scenting this oil, maybe with like some lavender or something.
Ooh,
really
yeah,
nice,
I love
right?
lavender. I put it in my hot bath.
It's
Lavender
great for
oil.
relaxing. So what the acupuncture facial can do is bring a lot of collagen and healthy clean blood and elastin to the area and diminish fine lines and wrinkles. And generally, after the acupuncture facial, after about 20 minutes or so, you do see a difference where your appearance is a lot fresher. But it does take about 10 treatments to see a really big lasting difference.
Okay.
And then after that, generally you need to come like once a month to keep it up. So what I'm going to do right now is I have this little, we're just doing the cupping facial, not the acupuncture facial. I have this little suction cup, and I'm going to very gently start encouraging some lymph drainage.
Okay.
And this is your, right here, this is your, called your sternocleidomastoid muscle. And we do tend to hold some tension in that muscle. So we're just trying to like relax that out and get some lymph drainage going. How does that feel?
Beautiful.
Yeah, it's really soothing, right?
Very soothing.
Okay. Do the other side. And this is just, when I talked about fire cupping before, this is just sort of a mini demonstration of cupping. When I do the fire cupping or the cupping on the back, the cups are large. They're about the size of a coffee cup.
Oh.
So, oops, sorry, I don't mean to cross over your face there. Okay.
Okay.
So we're just getting some, relaxing the sternocleidomastoid, getting some lymph drainage. Now we're going to go along the jawline. And what this reminds me of a little bit is there was a social media trend, I think it was a couple years ago, where one of the Kardashians was using a shot glass to plump up her lips.
Oh.
And, if you don't know what you're doing, it's not a good idea. But it kind of reminds me of what she was doing a little bit, because basically what she was doing was creating suction, to bring... basically it was doing the same thing, bringing blood and collagen to the area.
Huh.
But it's very gentle, it's very relaxing.
I forgot to tell the people, when you graduated, you were how old? 57?
57.
And you graduated cum laude?
Magna cum laude.
Oh, magna cum laude. Yeah.
I had a 3.98 grade average.
Wow.
Yeah.
And you were one of the oldest people in your class, right?
I think I was second oldest, yeah.
Wow.
Yeah.
See, world, what we can do? We never stop learning.
Well, I had a lot of help, too. My boyfriend, Steve Kellner, was very supportive. His family was very supportive. My girlfriends, my bestie, Rosa, and my girlfriend, Aniko, and my girlfriend, Chris, were really emotionally supportive.
Yes. Yes.
Aniko really invested in me financially, which was really great of her.
Very great.
So I had a lot of help.
Which is beautiful. That's what it's all about.
Yeah.
People helping each other fulfill our goals.
My boyfriend's family I'm getting the marionette lines around the lip.
Okay.
So it pulls the lip a little bit.
No, it feels good. Everything feels good.
And there's a slight chance you might get a little bruise that fades in a day or two.
Oh, no, I don't worry about that.
You can always tell people I beat you up.
Oh, no.
Okay, stop talking for a minute. I know that's hard for you. Stop. Relax the mouth. Okay. I want to get around the lips and get those little fine lines. See if we can plump them up a little. Sorry, Glenn. I know it's not the best shot, but I'm...
Not good
Yeah.
from 3 angles. It's
Oh,
good.
okay, cool. And then this is the nasolabial groove. Plump that up a little bit. You know what we should have done is taken a before and after picture. See if
That's
we
true.
see a difference. But anyway, most people find this like really relaxing.
It is very relaxing. I could go to sleep.
Mm-hmm. There are even TCM doctors who are so good with the cosmetic acupuncture, they can even do body sculpting, where they do like breast lifts and things like that.
Really?
Now, I'm not that experienced or talented at it, so I don't do body sculpting. But yeah, they can actually firm around the breasts and lift your butt and, you know.
Wow.
Yeah, so you don't have to go under the knife, you know.
And you say
TCM, or TCM, Traditional Chinese Medicine.
Okay, that's what
That's
it
what
means.
it stands for. It also stands for Turner Classic Network, but that's not what we're
Oh,
talking
no.
about. Okay. Get rid of those frown lines in there.
Yeah, I do have those.
Well, we all do. There we go. So you can imagine when I'm doing this with a great big cup on your back, how good it feels, because I really run it like how I'm running this over your forehead. I run a great big cup like I'm ironing a person's back, up and down their back. And it basically functions as a reverse deep tissue massage. So the cupping on the back is great for pain relief and insomnia. And it's really... I used to like love to have people do that to me in school.
Yeah, I was going to ask you, can you do this on yourself, this facial?
Absolutely. A lot of
good.
my Asian girlfriends, even if they're in their 20s, they do this to themselves every day.
Well, I noticed how good your skin looked when I saw you
Thank
today.
you. Thank you.
Yeah, I said, God, she looks young.
Thank you, Rita.
You do. It looks really good.
Well, I appreciate that. But, you know, I do a lot of clean living. I don't smoke. I don't drink. Well, drink maybe once a year. I have one drink.
Right.
One little shot of tequila once a year is
Right.
good for you.
Right.
But, yeah, I eat very healthy. I don't smoke. I don't do drugs. Most of my medical treatment is through traditional Chinese medicine. I do try, and my girlfriends that I went to school with, I do try and like trade with them, and we treat each other when we can, but we're all pretty busy. So, all right, I'm going to take the oil off your face with a towel.
Okay.
All right.
I think I'll go to sleep now.
You're good. Okay, so
Wow.
that's your facial, and
Thank you,
I guess we're going to
Lisa
go
G.
get the needles out of your knee.
Okay. Wow. I feel so nice and relaxed.
And that's one thing that I find really sad is that if you go to an MD and you don't like the treatment, you go find another MD. But most people, if they try acupuncture, if it doesn't help them, they don't
That's it.
try another acupuncturist. They think it's the medicine and not the practitioner.
I see.
Again, I would wash my hands if that was available, but I'm using a little hand sanitizer.
Right.
And we're going to go ahead and take the needles out. Here we go. Boop.
Don't feel a thing.
Boop. Boop.
And do you
Well,
have to
some-
throw those needles away?
Yeah, they go in a red biohazard bin, and
Oh,
then
wow.
I have a service that takes the bin. And you can see a few drops of blood here. There's nothing wrong with that.
No.
Generally, people don't bleed when they get acupuncture, but if you do get a few drops of blood, that is not necessarily a bad thing. It means that we circulated some clean blood to this area.
Good.
And there is a form of acupuncture that I have not done, but where they do actually bleed you on purpose.
Oh,
But I've not done it myself. Okay.
feels good.
So why don't you go ahead and stand up? We'll see how that. Well, you just stood right up there.
Yes, wow.
How does that knee feel?
Feels great. Feels absolutely great. Wow.
Yeah, you have much more freedom of movement.
Oh yeah. Did you see how easy I got up?
Yeah, boom. And usually I kind of
Yeah.
you have to wait, or I kind of pull you up.
Usually I have to, I wait, and then I say to people, "Oh, I have to get my sea legs." That's what I call it. But that's.
I know, like
amazing.
when we go out to eat,
Yeah.
we usually like
Oh,
kind
yeah.
of pause.
And then I say, "Wait a minute, I have to
Yeah.
get my sea legs," and then I get going. But
Yeah.
this is interesting.
See, now this goes to Glenn's question about should you wait until you're hurting or sick? No, you should
No.
come see me,
Yes.
and then you won't have the problem getting up.
Exactly.
Yeah.
Now I must say the right knee feels 3,000 times better than the left knee. So that's interesting.
Yeah.
It really did work.
So next time we'll treat both knees.
Yeah, but I'm just saying, and the left is, I never complain about anything, but
Oh,
I
I know
mean,
that.
that really is good. Now let me give you your present.
Oh, okay. I think this is it here.
Do you need this on your back here?
Yes, thank you.
That's for you.
Okay. Let me just close up the
Oh, yes.
biohazard bin,
Okay.
so we don't want that being available. Okay.
Okay.
Well, Rita, you didn't have to get me a present.
Well, no, but this is, I appreciate you coming over, and it's right up your alley. I think you'll like it. I hope.
Well, I'm sure I'll like it because it's from you.
Oh,
I'm gonna have a hard time opening it.
I'll just tear it off a little. Hey, there's the scissors over
Oh wait,
there.
I got it.
And I wrap it with wallpaper. I never buy
Never
wrapping
waste
paper.
anything.
No. So if people don't want, they throw their wallpaper away. They say, "Do you want it?" I said, "Oh, I'll
That's
take it
actually
home."
really pretty. Somebody had this wallpaper.
Yeah, a kid's room.
Oh, that's darling. A little girl's room.
Yeah, a little girl's room.
Oh, what did you get? Oh, barley tea.
Yeah.
Oh, thank you.
Do you like it?
I love it. Thank
Good,
you.
good, good,
And,
good.
and I actually have a little present for you.
Oh my gosh! You already gave me a present.
Well,
You gave me-
I actually have some tea for you.
Oh.
Is it okay if I cross?
Yeah, you can do what you want.
Okay. So, now do you have a tea stringer?
I do.
Like a tea ball?
Yeah, I do have a tea ball.
So this is chrysanthemum.
Ooh.
It's a Chinese herb,
Yes.
but we also know it as a flower, obviously.
Oh.
I'm sorry, it's not chrysanthemum. It's chamomile.
Chamomile. Okay.
So good before bed.
Yeah.
And great for the eyes. Really good for the
Okay.
eyesight.
Okay.
Okay, these two herbs, this is licorice root,
Ooh.
and this is a Chinese date called datzao.
Mm-hmm.
You can actually, like if you want to bite that, you can taste the licorice.
Mm-hmm.
Right? Don't swallow it though. And, but you can taste the licorice, right?
Yes.
So that's very good for your throat.
Oh.
And then this is a Chinese date.
Can I eat that?
Yep, it's called datzao. There's a pit in it.
Oh.
Don't eat the pit.
No.
So it's pretty sweet.
Mm-hmm.
So the datzao is generally when you make a formula, or you can throw it in here, is to sort of harmonize the other herbs. The licorice too. And it's also very good for your spleen channel. So when I make a tea, a lot of times I'll throw a datzao in to sweeten it instead of sugar.
Oh.
And then the licorice, if you put this in tea, it's pretty strong, so don't use a lot.
Oh. Okay.
So you can combine these, you can do them separately, do whatever you want. But the
Okay.
chamomile is to help you relax and sleep, and it also helps with bowel movement, and it's very good for the eyesight.
Oh.
Okay, the licorice is very good for the lungs
Oh.
and for the throat. And the dot sao you can just sort of use to sweeten stuff up.
As a sweetener.
Yep.
Yeah.
So that's
Thank
all
you
for
so
you.
much.
You're welcome.
Thank you, Leesa G.
Thank you for
It
having
was
me.
it was so nice to hear all these things you're talking about, and I'm hoping we're inspiring the other people that watch our show, because it's an opening for my mind, and I hope we're opening everybody else's mind,
Well,
because
you're a very inspiring person, Rita.
oh yeah, well, I just see the good in everybody, and you sure did show a lot of love today.
Well, I feel a lot of love for you.
Oh good, thank you. Glenn, what do you think?
And cut.
Okay. See, world, what we can do? We never stop learning.